Hello, my name is Winnie Barawa. Welcome to our session on history taking. So if you're following, this segment is focused on the nursing care case study, and this now takes us to our practical bit, how to write a nursing care case study. Where do we begin? So I have segmented this practical side in that we'll be beginning one part at a time, and that is history taking. We go to the next part, until we are done with the case study. So I know several of us had asked, Winnie, why don't you just teach us how to write a nursing care case study? It could be demanding. I don't know how it's done. I'm stranded, and most of us are wondering. So I've created like a guideline, a step-by-step guideline on how to write a nursing care case study. So let's begin together. And those who are new, don't forget to subscribe. This channel focuses on lessons, lectures, and expert interviews pertaining to healthcare. It's not, I know most of the time I do nursing only, but it's not based on nursing. It has other bits that you can still learn. You can check through our playlist, get a playlist that caters for your needs, and enjoy our platform. So let's go in and start writing our nursing case study. In the previous videos, I have introduced the aims, I've introduced the objectives, and I have introduced the components of the nursing care case study. Now here I am writing now, or rather we are writing this together. So let's see and start with the first part, which is history taking. When it comes to history taking, what are the parts and how do you organize the history taking? So in the history taking components, we begin with the patient identification data, or what we famously prefer to call biodata. Others prefer to call it demographic data. There's no problem. It's still the same thing. So in patient biodata, there are different components that I tell students don't forget to put in. It may look like something unnecessary, but please put it there. It's part of the ways of putting patient information together. So there's the patient name, and if you can't get all the three names of the patient, but in case study, because of what we call privacy, you can talk about patient initials. But in the files, of course, you'll get the patient name. So you can use patient initials or the full patient name. 3 names is good. Then you have the age, which you give it in years, or you can also indicate there the birthday, like full of the birthday. Then there's sex, there's religion. On the sex bit, there are places where they can advise you to have gender instead, so you can explore the different diversities that someone identifies with. Then there's religion. We have the telephone number, address and residence, level of education, occupation, and the next of kin. In the next of kin, it's needed that you expose the relationship of the next of kin. Then have date of admission, the client, patient identification number. So this is more of like inpatient number, like in the ward where this client was admitted, what was the inpatient number that they were using? Then put the ward that the patient has been admitted in, the bed number of that client. Don't forget marital status. Then don't forget the confirmed diagnosis. Don't put in impressive diagnosis. You need to put the confirmed diagnosis that the client is being managed on. Then we've got hospital name. Though some places you may not have to use the hospital name because the document automatically comes with it, but have the hospital name if it's an independent case that you're handling on. And then you can have extra details if you wish to, like the team that was caring for this patient, the doctor's name, the nurse's name, or the multidisciplinary the people or the multidisciplinary team that was caring for it. And then the second bit of history taking is the chief complaint. Chief complaint highlights reason for the visit. Reason for the visit, in some places we talk about reason for encounter. So in this part, you want to give us as much details as possible as for why the patient has come, but we shall shorten them. We're not going to put it in prose. We're not going to write stories about this. We're just going to put it in summary form. So for example, if they report to you about chest pain, you just put it there in points form, like chest pain for how long? 5 days out of a week, or is it 1 day? You highlight shortness of breath. So you will be highlighting the symptoms that the client is verbalizing to you as we take the history, and then we write them in short form. Here we are not doing a lot of stories. It's just points form of our client major complaints or major reasons why they have come to the facility. And then the second bit is history of present illness, short formed as HPI. So in history of the present illness, we are looking at most is we are restating our chief complaint, but we are going to explain it. We are going to use prose. We're going to write it in a paragraph statement. So in this part, you're told we need to describe the symptoms in terms of being comprehensive and detailed. So like the quality of the symptom, severity of the symptom, the duration, how long if it was a chest pain, the timing, what time does the chest pain come, and the context. So you want to ask if it's a chest pain, at what particular moment do they get it? Is it after sleeping? Is it after waking up? Do they get it if they sit in a certain position? You need to describe the context. And then they need to describe modifying factors like what makes the patient feel relieved or what relieves the symptoms and what makes the symptoms worse. So the HPI is normally written in prose or in simple term. We are going to write this in paragraph statement. We are not going to write this in points form. So HPI is written in paragraph ways. So, and then you need to have a starting point when you're doing the HPI. For example, the patient was well until 5 days prior or 5 days before when they developed all these chest pains that was either radiating to the backside or they were having chest pains that were getting relieved with sitting in a particular position. You need to describe it in details and it should have appropriate flow. The history needs to be flowing. We need to have a clear progress. We have clear flow and then there's continuity. You can tell when the problem started and how it followed. You need to bring out the client seek any management. So there's continuity, there's sequence, and you can take or rather you can get a chronological order. So have flow in it, have continuity, and clearly give us a sequence or chronology. So we need to feel that, or rather we need to see that. So that's about history of presenting illness. Please note, you do this in a paragraph, not in prose. There's some culprit status where some students use points and they're using these bullets to just highlight history of presenting illness. That's not how it's done. We use a prose. And then again, we have the other part which follows, where we talk about past medical surgical history. So in this past medical surgical history part, we want to bring in past experiences that the client has had in regards to medical management and surgical management. So you can focus on what are specific diagnoses have they been managed on? Have they had any chronic illnesses such as diabetes, TB, hypertension, blood transfusion issue? Was there like tuberculosis, congested heart diseases? You want to look at all these major illnesses that they could be managed in. So normally we are told with the diagnosis, you need to be very specific. Talk about the diagnosis that the client was managed on in terms of when did it happen? Did they have any complication? Have they had any specific major investigations that were done on them? Were there like surgical interventions that were made? Let the client bring out all these details and then prioritize this diagnosis according to the severe and to the most relating case. So maybe someone was managed on an orthopedic case and now they're complaining with an gynecological case. Well, you may want to highlight this diagnosis based on the relationship. Could be the orthopedic case was due to an injury and now they're coming with a gynecological case. You want to merge and relate. Is there any relationship between the previous orthopedic diagnosis and the current gynecology diagnosis? Are these two related? And then list any past admission cases, hospitalization, surgeries, give the dates and even the age when this was done. And then bring out admission due to chronic illnesses. Discuss, mention this admission with their diseases. Describe the management that was done when this client was in that particular state. So highlight the past medical and the surgical histories. Got now socioeconomic history. This is an interesting one because it's carrying two parts, and most of the time, unfortunately, majority of us talk about one side and we don't talk about the other part. So talking about socioeconomic history means a person or an individual needs to describe the social aspect and the economic aspect. So what does social aspect look like? Social aspect caters to issues like marital status, the lifestyles, habits that the client practices, recreational activities that the client could be participating in. And then the second part of economic is you want to talk about occupation, which job are they employed in. If they're open enough, you can talk about the household income, how much do they earn at that particular time. And then mention also about insurance. Insurance is very key because it will show you the patient ability to cater for medical bills. So you're told to describe occupation, to describe the job they are working, because this could be a risk factor or a determinant of their health. Then the significant significant social relationship and their support system. So we are bringing in issues around marital status, sexual partners, housing, and any related social support. And we want to now discuss also functional status, activities of daily living, the living conditions. Talk about where do they live, how is their house organized? Is it a house that has proper ventilation? Is it a house that is single roomed? How is the sanitation of that particular house? So this social data has to come out clearly. Then lifestyle means talk about any recreational activities and lifestyle that they do. Do they smoke? Do they use substance of addiction? Do they use anything that you can feel has a connection also to their illnesses? So you want to pull in as important data around social and economic history as possible. So don't just close it as the client is married, has 2 children, works in this particular company, and that's it. You have to create a flow. Again, this also you use prose or paragraph. You don't write it in point forms, but you want to create this as a nice paragraph that caters for the different parts. So you want to create a paragraph that brings out the social status and a paragraph that brings out the economic status of the patient. Very key parts that you shouldn't forget. And then we have the family history. So now let me clarify. Family history, my advice is put it separate. Don't mix it in the social history where you talk about the children, siblings, or relations in the social. Keep the social and economic history free from the family. Then go to the family history and discuss the family part. So how is family coming in here? In family, you want to determine if there's let's say there's a congenital illness that could be related, or there's a genetically familial history that could link to the current medical or surgical diagnosis that the client has. So in here, we are describing the state of health of mostly all the first degree relatives. So is there any illness among the siblings that you need to tell us? Or is there an illness for the parents like mother and father? If their children and spouses, also bring up their health status, because in this you can relate. If there's any transmissible illnesses that is among the children, maybe it was also contaminated and it spread to the patient whom you're managing at that particular time. And then in this case, now you want to move to the other degrees, like second degrees. So you're told document all significant positive and negative family history that is pertinent to the patient major problem. More so here now you want to go to the second degree, like nephews, nieces, aunts, uncles, grandparents. So you want to take the relations further by linking any generational related illnesses that our client could have been inherited or is suffering from. So you prioritize the first description should be the first degree relatives, and then the second description should be the second degree relative. So you can pull a wider string, or you want to pull a wider attach about the relations in the family history. So that's why I was saying put family history on its own. Don't combine it in the socioeconomic history because you will not be exhaustive. You'll just write a single sentence and then it doesn't bring out as much details as you wish to do. Then you have another component of drug and food allergy history. So in the drug and food allergy history, we look at their components of drugs, or their components of food that this client has reactions to. So if there's certain medication, maybe the client takes and they usually have adverse reaction, we would like to address that early enough before we intend to administer and then the client gets affected. However, it's advised anytime you are administering medication, always rule out allergies before you administer. But even in the history, we can get this early enough and state it in that history that the client has particular allergies or the client has particular adverse reactions pertaining a particular medication or particular food. So list all these allergies and their adverse reactions. So the part of drug and food allergy normally brings us to the last part of the history taking, and it normally gives you now another chance to think around, are there particular other parts of the history that you wish to add on. So normally I also advise that if you're doing the history, look at the uniqueness of the case and pick other history that you can incorporate. So for example, if you are talking about women who are of reproductive age, I will advise you also bring in gynecological history. If this patient is not pregnant, for example, or if this client is not expectant, bring in the gynecological history so that you can explore any history of the gynecological conditions like ovarian cyst, fibroids, infertility, endometriosis. Talk about this, bring them up so that in case of any known, you can rule it fast. You can rule it out fast. Then we got another history, what we talk about menstrual history. So with menstrual history, here we are looking at women who are still in their reproductive age, but they are still experiencing menstrual period, or we are talking about a woman whose history has a key contribution with the menstruation. So you want to ask those details. E.g., if a pregnant woman is the one you're questioning at this particular time, or you are taking their history from, you want to ask about the age of their menarche, the cycle length, days of the flow. You want to also check how heavy the flow is by getting to understand the number of sanitary towels that they use or change in a given day. How are the clothes? Are they large or are they small? You want them to understand all that. And then their last menstrual period and any associated symptoms. So during their menstruation, are there any symptoms that they experience and they would like to tell you more about it? You can ask on that. So with associated symptoms during the menstruation, there could be complaints like back pains, low abdominal pains, nausea and vomiting. You want to ask such complaints or such related complications that come along with menstrual history. So these are part of special history that you can pull in while you're doing history taking in the case study. Like I'm saying, you need to be keen so that you can tell in advance which extra history you wish to include in the given particular case. Then we got these other histories here. Here we talk about obstetric history. So with obstetric history, this one we normally have it in expectant mothers who are currently pregnant. And with expectant mothers, this one comes on another case, a special case. We talk about the midwifery case studies, which usually it's compulsory. You need to pull in the obstetric history. But in a case where a client who is expectant has come in and needs to be taken care for general management, maybe they have a medical condition during their pregnancy journey, you may want to bring this in also during that history taking bit. So you may want to provide their current pregnancy history, you want to determine their gravidity, you want to establish the parity, contraceptive histories, and the past pregnancy outcomes. So in the gravidity, you want to basically determine, the number of pregnancies, you want to establish the number of live births and all those aspects, the number of lost births. So this is what gravidity and parity is going to cater for. But for the pediatric clients, this is another second part you can check on. Pediatric history. If you're taking history from a child, then you can pull in these other parts. You can pull in immunization history. So in the immunization history, you want to determine if the client or the child has achieved the immunization schedules, that is at birth, 6 weeks, 10 weeks, 14 weeks, or whatever stage that the client is at and you are taking the history at. And then you want to check on the following, like child developmental histories and milestones. Then you also wish to establish the nutrition history. And of course, this is just to guide us. But if there'll be any other history that you wish to bring in, well and good, you can always add it there. But these are some of the basic other histories that you can add as you're doing history taking in a case study. So I really appreciate you being with me all the way to this end. My name is Winnie Barawa, and those who are new, please remember to subscribe. Those who are returning and have not yet subscribed, please do so. So like the videos, share it, and don't forget to leave a comment so that we can engage and bring in more ideas of how we can make our videos better. Thank you, and see you in the next lesson.